Dr. Claudia Lucchinetti, and I'm a professor of neurology and a consultant here in the Department of Neurology at the Mayo Clinic. And I am going to just update you here a bit on some recent interesting and exciting research that we've been doing on the role of the cortex in multiple sclerosis. This study was done with my key collaborator, Richard Ranzhoff, at the Cleveland Clinic, and a number of Mayo collaborators, particularly in the Department of Pathology, Joe Parisi, Bernd Scheithauer, and Caterina Giannini, as well as my close collaborators in Saskatoon, Dr. Bogdan Popescu. All right, so now to tell you a little bit about the work that we're doing that's coming out in the New England Journal of Medicine, and that really focuses on the role of the cortex in both the pathogenesis and progression of multiple sclerosis. So the cortex is the outermost layer of neural tissue that surrounds the brain. And it's traditionally been considered an area that really hasn't been so important in understanding what's going on in MS, because we think of multiple sclerosis as a disease of the white matter. And that's because the white matter contains the majority of myelin. In reality, the cortex, proportionally speaking, it represents less of the brain, but the percentage of cortex that is involved in a chronic MS has been known to be quite demyelinated, which means that although there's less myelin there is quite a bit of evidence that this cortex is significantly damaged late in the disease. We had a unique opportunity at the Mayo Clinic to be able to study multiple sclerosis from patients who may have undergone a brain biopsy when the diagnosis was in question. Now, these biopsies were done when patients presented perhaps with an unusual MRI or an atypical clinical presentation, and a lesion was seen in the white matter, which was thought to perhaps be a tumor. So a brain biopsy was done, and in the course of this biopsy, you have to actually travel through the cortex in order to reach the white matter lesion. So essentially, the cortex was being sampled randomly. This provided a unique opportunity to really carefully characterize the cortex in the earliest stages of MS. What's critical to recognize that although these patients presented in a somewhat atypical fashion, very careful clinical follow-up of these patients showed that they went on and developed fairly typical MS. Therefore, we feel that the findings we're about to describe are really able to be extrapolated to typical MS. So our objective was to sample in a large cohort of cases who underwent biopsies, over 563 patients we collected over the years at Mayo, and determined that among those 563 biopsied cases, 138 patients had cortex sampled. And what we determined was that in 38% of those patients, there was evidence of cortical demyelination. And this was in patients just within typically days to weeks of clinical presentation. So first of all, that was an important observation that the cortex is involved very early in MS. This actually supports data from MRI studies that the cortex is involved early and can be a significant predictor of how a person's going to do long term. So it became very critical to understand what was going on in the cortex at this early phase. So this really gave us a key insight into the fact that not only is the cortex involved early in the disease, number one, number two, that it is highly inflamed, number three, that this inflammation strongly correlates with destruction within the cortex, and number four, this inflammation is very tightly associated with the presence of cortical demyelination in the relationship of the meninges to the lesions, and that we believe that the meninges are implicated in the initiation and the perpetuation of the disease process in MS. What is unknown is to what extent our current therapies even impact this important process going on, because we recognize that patients, even imaging studies tell us that patients who might present and have evidence of early cortical damage may be those very patients who are likely to go on and develop progressive disease. And it's often the case that patients wonder at disease presentation, am I going to go on and have progressive MS? Well, understanding what's fundamentally occurring in the cortex at a pathological level can help set the stage for characterizing what's going on an imaging and clinical level. And we believe that this important research really opens the door or the avenue for further research in understanding the role of the cortex in both the pathogenesis of the disease and ultimately how to target therapies that impact this process. Because at the end of the day, we don't know if our current multiple approved therapies for treating MS even impact this important site of tissue injury in multiple sclerosis. The work is unique because virtually all that is known about cortical involvement in MS is based on the analysis of long-standing progressive MS patients in whom autopsied tissue was analyzed. So this is the first and only pathological study that has really opened a window into what's going on in very early disease phases. No other study has described this pathologically, and although we had clues from MRI that the cortex might be involved early, and we even had clues that the cortex could even be the initial site of injury in MS. And although we think that white matter is where all the action is taking place because we can see it on MRI, for example, the reality is that the disease could actually be beginning in the cortex and propagating the whole process. So the fact that we were able to capture what was going on early in the disease in a site that you really can't see unless you have tissue to look at it really are some unique aspects. The inflammation in the cortex is somewhat different than the inflammation in the white matter, so we really need to better determine how to analyze this on MRI in a much more sophisticated way, and to be better understanding the mechanisms that are at play so that we know whether our therapies are even beginning to target these very early events that really might be setting the whole ball in motion. So I think we really provided a unique insight very early in the disease, and I think that's really why the New England Journal of Medicine saw this as a paradigm-shifting study, in that we opened up insights, or we provided insights into the earliest events in MS pathogenesis that to date have not been described. And they also, to some extent, they don't contradict what's been known late, but they do provide information that really couldn't have been determined when you study an MS brain after a patient may have had disease for 30, 40 years, because by then those processes have largely died out. Treatments in, and it really does, I think, raise a new direction in terms of understanding that rather than the disease being an inside-out concept, meaning starting in the white matter and perhaps involving the cortex, which is what was traditionally thought, we actually argue that it's an outside-in disease in which the process is really occurring in the outermost layers of the brain, in the cortex, and in the subarachnoid space. And this is really a paradigm shift in our thinking of how MS even begins, let alone what is specifically being targeted at the tissue level. And I think ultimately this really highlights that MS is a global disease. It is not just a global brain disease. It is not just a disease of white matter. It is really a disease of the entire brain. And if we ignore these central critical sites, we may not really make significant advances in limiting what's happening long term.